Everybody, welcome to your Nursing Education Seminar 2 course. I'm Dr. Tracy Hardell and I'm going to be your instructor. I am very excited to be part of your educational journey and I'm really looking forward to getting to know all of you better. First, please be sure to look over the announcements. So they're under the Announcements tab. There's a few of them. I've divided them out, so if you need to go back and reference them, you can find them pretty easily. So be sure to look over those and definitely post your bio on the class wall because it'll be great for us to get to know each other better over this next 8 weeks. All right, so you guys have already had Seminar 1, so this course is definitely going to be building on that. We're going to be digging deeper into teaching learning activities, evaluation strategies, technology, and distance education. You're also going to be continuing with the course that you started developing in Seminar 1, okay? And then we're going to incorporate some really much more recent developments. For instance, the National Council of State Board of Education, or the National Council of State Boards of Nursing, has really taken on the task of changing the NCLEX to really focus on bedside decision making. They have developed something called the Nursing Clinical Judgment Model. I don't know if you've heard about that. I'll be bringing that up sometime during our course. And it very much focuses on clinical decision making, clinical judgment, very much high-level thinking of nurses. Every 3 years, the National Council of State Board of Nursing does a practice analysis. They survey thousands of new grads who have taken the NCLEX within like 3 or 6 months. And they ask them about what things are you actually performing at the bedside, what knowledge do you need to have, what skills do you need to have, and then they really analyze that. And so we're finding that new grads, surprise, surprise, really need to have that clinical judgment to be able to practice at the bedside effectively, even with the nurse residency programs that are out there. So we'll be getting into that as we get more into the course. Okay, so for this week, we've got 2 discussion questions. So the first one, you need to find an article outside of the course resources on designing learning activities to promote critical thinking. To me, this screams active learning strategies. I love this approach to teaching. There's nothing worse than sitting in a very dry lecture for possibly hours on end. Some of my favorite active learning strategies are unfolding case studies, having students plan nursing care based on either a video or audio recording, and I love simulation. So those are I love active learning strategies, but those are just a few of my favorites, and I can't wait to see what articles you come up with and what they focus on. The next one, the second discussion question, has to do with principles for selecting active learning strategies. One of my biggest pet peeves is when instructors use active learning strategies just for the sake of using them, like gaming just for the sake of having a game offered during a course, or if you're teaching in the clinical setting, the same thing. An active learning strategy always has to have a purpose. It always has to tie back to your student learning outcome, whether that student is a nursing student or a nursing staff member. It always has to tie back to your outcome, and you always have to have a way to evaluate whether or not you achieve that outcome through your active learning strategy. And some nursing educators don't realize how that all has to tie together. So we'll be talking about that a bit this week. All right, so you don't have any assignments due until week 3, which is great for you, but great for me too. Anyway, really carefully review the assignment directions and the rubric for that assignment. You will need to concisely describe a technology application and how it can be used to achieve a professional standard or competency. So you're just going to have to really think about that, do a little research in the literature, and you will have a choice of how you want to present that material. So you can be thinking about that. I have been told at times that I can be a little bit of a hard grader, but in reality, I just go right down the list of directions and write down those top box rubric descriptions. So if you really read the directions and follow them, if you really try to fulfill the rubric descriptions, you're going to do just fine. So this course can be a great learning experience. I would really encourage you to try to stretch yourself a bit as opposed to doing the minimum. I know that can be hard with trying to balance school and work and family, but this is really a great course to dig into nursing education. And also, if there is a particular area about nursing education that you're interested in learning more about, maybe something that the reading just touches on, please let me know. I will provide more resources and we'll be able to explore that within the course. So I want you guys to have some say in kind of driving our direction. So please let me know if there's something that you'd really like to touch on. All right. So that's about it. Please let me know if you have any questions as anything comes up in your readings or assignment directions or anything like that. And I'll see you in the main forum.